Namaste, myself Dr. S.P. Moosath. Hyperactivity. How to reduce it? Many are asking this question. But to reduce hyperactivity, first thing that you have to find out what is the reason for hyperactivity. In my experience, I have seen we need to do two things, basic things to reduce hyperactivity. The very first thing is to train the kid what they doesn't like. To train the kids what they doesn't like. This is the first rule that you have to maintain. The second rule is to train them how to restrict what they like. To train them how to restrict what they doesn't like. You just think of why kids are showing hyperactivity. To get something. To show escapism or to escape from a condition. These are the two things that to show hyperactivity. So if the kids are accepting the situation what they doesn't like, they will not show hyperactivity, because in the childhood days they are trained like after getting or to get something they need to cry. These are the training that we give usually for kids. When they cry, we will give. When they don't cry, we may not give. So the script in the mind will be like, I need to cry to get something. So the first thing, basic thing, maybe the small things also as a food. For example, if a kid like dosa or idli more, we will try to give idli and dosa, otherwise they will not take anything. What is the basic concept behind that? They don't like upma. So we will be giving more dosa and idli daily, so that at least they will take something. That will be there in our mind. So it should not be like that. It should be like to train them what they doesn't like also. For that, many ways are there. I will teach you day by day. Second thing, we should train them how to restrict what they like. If they like dosa, giving dosa every day may be easy for you in the present moment. But in the age of 5, their likes will be different. In the age of 10, it will be different. In the age of 15, it will be different. In the age of 20 and 25, it will be very much different. In that age, if you try to make a change, you will be a 100% failure. That time, you may have to take him for any psychologist, for counseling, or some psychiatric medications, everything you may have to go. So, we don't want to wait till that time to make them correct. Start from the day one itself. List out the things that your kid doesn't like. List of the things that your kid likes most. Match these two. You do this, I will give this. So at one point of time, they will have acceptance for both the items. It should not be like after they cry, you give. Be in your statement. That is another concept that I will let you afterwards. Be in your concept, in your statement. So giving whatever they like will give you a short-term happiness. Training them to accept what they doesn't like will be giving you a long-term happiness. Just select, you need short-term happiness or you need a long-term happiness. Namaste.